Welcome to South Tyneside and Sunderland NHS Foundation Trust. My name is Marie Hayden and I'm an orthopaedic nurse practitioner within Sunderland Royal Hospital. These videos are aimed to help to prepare you for your forthcoming surgery. We believe that the more information we can give you prior to surgery, the more prepared and empowered you will be and to help aid a speedy recovery. The videos will give you specialist information on exercises and what to expect when you come in as an inpatient, the care that you will receive on the ward, and our specialist teams will provide information on what will happen when you discharge from hospital and the care you will expect to receive back in your own home. Prior to your operation, you will be invited to attend a pre-op assessment clinic. This is to ensure that you are medically fit for your surgery. The nurses will undertake a comprehensive review of your past medical history, any previous surgeries and any complications from surgeries, or any allergies that you may have. Please bring with you a copy of your medications that you are currently taking. Part of the assessment, the nurses will undertake some routine blood tests and also some screening swabs. These are for control of infection purposes. They will provide you with the kit that you have to use 5 days prior to surgery. The instructions will be included in the kit. Some patients are required to come back for further investigations or perhaps meet an anaesthetist for an anaesthetic opinion prior to surgery. This will be done on an individual basis. The average length of stay is about 2 to 3 days. The vast majority of our patients are admitted to hospital on the day of surgery. Please bring everything that you require with you. We suggest day clothes, nightwear and sensible walking shoes. Please bring with you all your medications in the boxes that are supplied by your pharmacist. We will use your supply while you're in hospital and they will be redispensed to you on discharge. Patients also bring in mobile phones. The nurses will greet you and admit you to the hospital and get you prepared for surgery. You will then meet the anaesthetist. They will discuss with you the options of types of anaesthetics for your relevant surgery. This will be an ideal time for you to discuss any worries and concerns you have. They will be happy to answer any questions. Following your surgery, you will be taken from the theatre into the recovery room. There will be a nurse with you the whole of the time and they will be checking your vital signs. This is to ensure that you are safe and well following the anaesthetic. They will be checking your blood pressure, your pulse, your temperature, the dressing to your wound. You may have oxygen on and you may have an IV therapy. When the nurse in the recovery area is happy with you, they will contact the ward and one of the nurses from the ward will come to the theatre and escort you back to the ward. We continue the care on the ward that has been started in the recovery area and we continue monitoring vital signs. At this time, we would actively encourage you to eat and drink and food and beverages will be supplied when the nurse has deemed it safe. We will make sure that your pain is well controlled. Pain is very subjective and every patient has a different pain threshold. The nurses would ask you on a scale of 1 to 10 how bad your pain is, 1 being the least pain, 10 being the worst pain, and you will be given analgesia accordingly. Please do not hesitate at any time to ask the nurses for more pain relief if you feel your pain is not being managed. Your surgical dressing will be left intact and nurses will not remove this. This is to help prevent any infections. Following on from any surgery, there is a risk of complications such as blood clots. We aim to prevent these by following NICE guidance. All patients will have compression foot pumps. They will be applied in the theatre area and they stay intact all through the first post-operative night. Other methods that we use are compression stockings, and if you have these are recommended for up to 6 weeks post-surgery. We also use medications, blood thinning medications, either in tablet form or injections, and this will be used depending on the type of surgery you've had and the instructions from your surgeon. The following day, the nursing staff will help you get washed and get dressed. We prefer you to wear day clothes during the day and sensible shoes. Early mobilisation out of bed is key. The physiotherapists will come along and assess you and get you out of bed. The nursing staff, the physiotherapists and the occupational therapists all work together within the ward. We aim to get you home when you are ready and deemed fit by all disciplines of the team. We have goals for discharge. When patients are achieving these goals, we will prepare your discharge home. We have nurse-led discharge. The goals for discharge are: you need to be safe and independently walking with whatever aids that you are requiring. Your wound has to be clean and dry. Your pain has to be under control. Any X-ray you may require has been taken and reviewed. And any help and support or equipment that you require is already in place. When you are ready to be discharged home, we will plan your discharge with you. Any information that you need will be supplied. We will provide you with information on your wound, on how this will be going to be looked after in the community. We will provide you with dressings. You will take home all your medications and any extra medications that has been prescribed while you've been an inpatient. This may include painkillers and blood thinners. Any review appointments you'll be informed of. These normally follow out in the post in form of a letter. Some patients will be reviewed by telephone, some patients will be expected to come to clinic. Contact details will be provided to you on discharge. This is for you to use if you have any worries or concerns once you are home. We particularly want you to contact us if you have any issues with your wound.